Welcome back. So, the numbers have been looking pretty good. Bexar County is seeing hundreds of new COVID cases a day, which is actually a lot lower than what we were seeing just a few weeks ago.
Yeah. So what does that mean now? Cherise Rohr Allegrini, an infectious disease epidemiologist, the CEO of the San Antonio AIDS Foundation, joins us now to answer some of our questions. Cherise, always a pleasure to have you on. Thank you.
Thanks for having me.
All right. So Metro Health says 365 people tested positive for COVID. Is that number positive news, or what are you seeing that goes a little deeper than just the numbers?
So I think it's great news considering where we were a month ago. Our numbers have dropped by more than half, actually even more than that, and that's good news. It's still a lot. It's concerning, but it's going down, and that gives me a lot of hope.
Do you think those numbers are going to go down even more?
Yes, I think they are. I hope so, but I do think they are. I think this is a kind of a normal cycle that we see with a lot of outbreaks. We're on the downswing of it. And as expected, this outbreak was pretty short.
Are you at all? I've gotten some messages on my Facebook from people who say, yes, the numbers are going down, but the number of deaths are going up. That is normal, though, correct? I mean, for the deaths to kind of lag behind the numbers.
Exactly. The deaths, usually because people are in the hospital for a long time and then unfortunately pass away, those numbers tend to go up after when we see the numbers of new cases start to come down, just because people are in the hospital for a long time. And that's a normal pattern that we see. Unfortunately, any deaths are a bad thing, but we do expect to see a slight increase in deaths, even though the numbers are going down. And we've seen that all along throughout the pandemic.
We also keep hearing about other subvariants or variants out there. Is there reason to be concerned about that?
Well, we're always concerned, and that's why we're constantly doing surveillance and we're finding those variants. We want to know and be able to be prepared to fight them. The good news about this newest variant is that it appears to be similar enough to the previous variants that our vaccine is very effective against it. Even though it's potentially more contagious, again, if our vaccines are working, it'll stop the spread of it.
Or at least lessen the severity of,
exactly.
of whatever happens. Is there... what does the end of this look like when we go from a pandemic to an endemic? What is that going to look like from a scientific standpoint?
So endemic just means that it's naturally occurring. It doesn't necessarily mean that it's better. A lot of endemic diseases are very deadly. So that's not necessarily the end goal we want to get to. We want to get to a point where this virus is not deadly and doesn't spread rapidly or gets to a level that we can control it. And that's really where endemic is. It's not that it's less bad. It's that we can control the outbreaks because we have this constant surveillance. We know when cases are rising. We know when to put in more control measures. And that's what we do with flu. Flu is very deadly, but because we monitor it so closely, we're usually able to control big outbreaks. That's what we're hoping to get to with COVID. The problem is that new variants are appearing all the time and our vaccination rates haven't gotten as high as we need them to get.
Is it possible to guess when we may get to the endemic part, or
Steve wants specifics?
I mean, I'm just curious if it's if you see that, or if it's too early to even predict that right now.
Epidemiologists would love to have a crystal ball, and I don't have it. I do think that we're getting closer to it. It seems that these variants that are appearing we're able to block them with the vaccines. And so I really think with increasing vaccination, we will get closer to a point where we can manage any new cases that come up.
So I have a final question for you here. A lot of school districts are easing up on mask mandates at schools, but we know the CDC is still recommending that students wear them when they're in classes. Is there a threshold, a number? What exactly is it that we're waiting for the CDC to relax that recommendation?
So there is a threshold of vaccination of 80%. Now that's more based on hope than actual strong scientific data. I should say it's based on a lot of educated analyses, but it's not a perfect number. But we generally feel that if we got a population level vaccination of 80%, the risk of transmission is greatly reduced. The thing about schools is that most kids are still not vaccinated. Even though we've got a fairly high rate of vaccination, almost 80% in San Antonio, in the 12 and older population, those under 12, it's still well under 30%. And so that's a risk where you're going to have more transmission. And even if it's not as deadly, more transmission means the likelihood for more variants to occur.
She's a Q&A regular, a disease detective. She taught me what epidemiologist means, so I appreciate all of that. Cherise Rohr Allegrini with the San Antonio AIDS Foundation. Thank you so much for your time.
Thank you.
Thank you so much for having me.